I don't need to take meds. I can heal all on my own. Antidepressants are scary. I might become addicted. Won't I become dependent on those if I start taking them? Today, we're talking about drugs.
All right, team, focus up.
Yeah. God, this is so good. Oh, this is gonna be awesome. Yes, so tired.
No, not those kinds of drugs.
My God, I hate drugs.
I'm talking about psychotropic medication. Since this series is about depression, I'll have a specific focus on antidepressants. But this will apply to other medications too, like antipsychotics, stimulants, mood stabilizers, and anti-anxiety meds. First things first about medications. Not all people will need them. Sometimes people underestimate the power of their own bodies and minds to cope and heal naturally. I always explain to people that when it comes to mental health, psychological professionals like myself should be the last line of defense. Meaning there are many things that they can do for themselves and by themselves in order to protect and defend against mental illness. And even then, sometimes psychotherapy alone might be the best treatment. It will always depend on each individual case. With that said, there are some conditions where medication is necessary. In cases where the patient has lost touch with reality, where delusions and hallucinations are present, such as severe psychotic depression, schizophrenia, or bipolar disorder, medications are necessary to help alleviate those symptoms, allowing the therapist to work better with the patient. Medicines don't cure the condition. Notice that I said that medications alleviate the symptoms. That's because psychotropic medications don't cure whatever medical condition you have. They only work to relieve symptoms and help improve quality of life. In the cases I mentioned above, antidepressants and antipsychotics work like maintenance medications, similar to cases of diabetes and hypertension. There are cases where people become capable of managing their symptoms well enough that they don't need to take medication anymore. But that's something that needs assessment from a psychiatrist too. Antidepressants don't make you high. Psychotropic medications don't work that way. They don't make you happy. What they do is help people reach a sense of normal so that they're able to feel the full range of their emotions. It helps normalize specific targeted chemicals in the body so that the symptoms of the condition don't get in the way of what is considerably normal functioning. That means people on antidepressants can still feel sad, but it's not the same destructive level of sadness usually associated with major depression. Medicines aren't addictive. They aren't. They don't have the same neurological effects as illegal drugs do. They don't make you happy, they don't make you euphoric, they don't cause you to trip out or become high. So there's no cause to become addicted. It's important though that if you want to stop taking antidepressants and other medications, that you seek the help of a doctor first, because stopping abruptly can cause some withdrawal symptoms. You need to ease off of it before stopping completely. The only researched medicines that have a risk of dependence and tolerance are benzodiazepines, a kind of anti-anxiety medication. Responsible psychiatrists, however, only prescribe this medication for short periods of time. If you feel yourself becoming dependent on antidepressants though, it's important that you bring that up with your psychiatrist. Medicines do have side effects. Antidepressants, for example, have these side effects: nausea and vomiting, weight gain, diarrhea, and sleepiness. The thing is, side effects are common with other kinds of medication too. The best example I can think of are how anti-allergy meds tend to make you sleepy. The best thing you can do is work hand in hand with your doctor so that he or she can help you manage the side effects of your medication better. Notice how I keep saying your doctor. That's because only psychiatrists can prescribe psychotropic medication. Nobody else is ethically or even legally allowed to prescribe you medication for your mental condition. Prescribing psych meds is a responsibility exclusive to their profession. I know about medications because I work closely with psychiatrists, and I have to know how specific prescriptions work when dealing with my own patients who are taking meds. When dealing with medication, it's always important to talk to your doctor. Whether it's about symptoms, side effects, dependence, increasing dosage, or stopping altogether, your doctor knows best and is on your side. Did you learn something new today? If you did, give this video a thumbs up and share this video with your family and friends. Make sure to subscribe to my channel for more psychoeducational content. Thanks, and I'll see you next time.